Hello, everyone. The Himalaya, the highest mountain range on Earth, home to snow leopard, the mythical Yeti, and mountaineers punch drunk on lack of oxygen. I'm deep into the mountains, 4 hours away from the nearest village. No electricity, no running water, no cell phone signal, definitely no broadband. This situation is what many people call a nightmare, or a worst-case scenario. My family calls it vacation. I pop inside to get a bottle of water, and there's this buzzing between my glasses and my face. Ow, this insect starts stinging me. And I rip off my glasses and I swat at it, and it keeps on stinging and stinging me, till I have to scoop it up into my hand and throw it away from me. After just 5 minutes, I start to feel faint. Then my throat constricts, and my tongue is swelling. I know the only thing I can do is to try to slow down the progression of the poison through my body. So I'm lying on the veranda, eyes closed, trying to block out all the commotion around me and just focus on breathing as best I can. I hear an unfamiliar voice. "Hello, Ros, my name's Vivian, and I'm going to take care of you. I just need to roll up your trouser leg and you might feel a slight sting." I hear a as everyone around me sees these angry purple blotches that are now covering my body. Then something is stabbed in my thigh. But after a couple of minutes, I can breathe more easily. It turns out that Vivian is a nurse who's volunteering her time with a local charity. I had no idea that she was going to be there. And she's just got back after 2 days away on house calls. When she sees me on the veranda, she immediately realizes I've gone into anaphylactic shock. And so she gives me an injection of adrenaline, a medicine that was discovered over a century ago by a drug company working with an academic scientist. Now, as a scientist turned drug dealer, that would make a great TV series. I know that I owe my life to Vivian and that injection. My husband is a high-altitude mountaineer, and he tells me that nothing he does is quite as dangerous as going on vacation with me. This experience in the Himalaya taught me 2 things. Firstly, it taught me about vulnerability. As a 30-something, I wasn't spending a lot of time thinking about life-threatening illnesses. But the speed at which my body shut down on me, what it showed me is that every single one of us is just 5 minutes from being seriously ill. And secondly, this connected me in a new way with my day job, because the drugs that I deal are legal drugs, like adrenaline, Herceptin, or insulin. And this near miss got me thinking about how disconnected patients are from medicines in development today. I believe that we need to reconnect the patients with the drug makers, because this lack of connection is stopping us from getting the medicines that we need. The truth is that promising treatments for important diseases are struggling for lack of funding, and the existing model for how the patient can change this is broken. How do I know that it's broken? Let me share with you my story from inside the industry. I didn't always want to be a drug dealer. So I was at school, I thought I'd be a doctor or a vet. So I signed up for work experience at my local vet. Let's just say I did not make it through to the end of my first surgery. To be honest, I didn't make it through to the beginning of my first surgery. I passed out before the dog. So clearly I had to give up on my dream of being a surgeon. And then I had to give up on my dream of being a scientist because I broke so many test tubes that my colleagues moved me to a desk job. Despite these early mishaps, things worked out, and I'm now an executive officer at a biotechnology company, supporting science from the business side. The company where I work is small. Like most young biotech, we've never made $1 in profit. We don't expect to for years. Last year, we were trying to raise money to test a new medicine that we're developing in acute heart failure. Patients with acute heart failure describe a pressure in their chest that feels like drowning. And drowning is a good description because your heart has become such a poor pump that blood backs back into the lungs, and then the fluid part of the blood starts to seep out. So in a very real sense, the patient is drowning, not in water, but in their own blood. If you were diagnosed by your doctor with acute heart failure, your prognosis would be worse than for most cancers. So clearly this is a very serious disease, but it's not a disease that's popular with investors. The problem is that no new drug's been successful in treating acute heart failure for over a decade, and other possible treatments have failed to show results in clinical trials. So nobody's made a lot of money recently in acute heart failure, and investors, they like to follow the money. And this isn't just limited to acute heart failure. More people worldwide suffer from diabetes than live in the United States. More people have Alzheimer's disease than the populations of California and Arizona combined. But neither of these diseases is popular with investors. What that means is that small companies, like my company, we're typically avoiding research in these areas. So how do we encourage scientists to work on diseases that are ignored by traditional investors, but which affect so many of us? We had promising early results, and the irony was that investors said they would be interested if we had data in acute heart failure patients. I said, come on, guys. That's the trial that I'm trying to persuade you to fund. What made this even more frustrating is that I knew if I could get the 30 million people worldwide who have heart failure and are at risk of acute heart failure, get them into a room like this one, and just talk to them, like I'm talking to you now. With a single dollar from each person, I'd walk out with more than enough money for the trial. So how do we create this room? And how do we fix the failure in communication between the drug makers and the patients? I've lived in America now for over 8 years, and I'm something of an expert at failing to communicate. I know that many Americans love a British accent, but we Brits are not always that easy to understand. When I first went to a restaurant in America, I asked for a glass of water. What I got was a glass of porter. And I'm still trying to work out how to turn water into wine. And it's not just our accents, it's our use of funny British words. You can imagine the look on my colleague's face when I wanted to erase a pencil mark from a piece of paper, leaned across his desk and asked if I could borrow his rubber. Yep, I am an expert when it comes to failing to communicate. The drug industry communicates with patients through advertising. I only started with a sniffle. By the end of the ad, I've got uncontrollable shaking, nervous tics, or temporary paralysis. Mind you, I think I had all of those waiting back there. We need to find a new way for the drug industry to communicate with patients, to make the patients part of the process, because without this, we've lost touch with our future health. We're missing out on medicines for millions of people. So what role does charitable giving play in this? On the face of it, a pretty big one. The American public gave over $31 billion to health-related charities last year. 31 billion. And that's equal to the annual gross domestic product of Panama. And until recently, I thought that much of this money was spent on medical research. And I'd still be thinking that. But 2 years ago, my father passed away. And when Dad died, I went looking for a charity trying to find new treatments for diabetes, the disease that had taken him from me. And I found lots of charities spending their money on patient support and education, diagnosis, Yeah, maybe some research. But I could not find a charity with research as its primary focus. And that got me thinking, is this just the case for diabetes? And so I looked at other diseases and how the charities in those areas spent their money. The next disease that I looked at was cancer. American Cancer Society is one of the largest disease-related charities, raising over $800 million from the public in 2012. I want you to think of this cake as representing that $800 million. I asked 100 people, what percentage of this would you like spent on medical research? And 89 of them said a minimum of 40%. The amount the American Cancer Society spent on medical research in 2012 was 16%. 16 cents in every dollar. The American Heart Association spends around 22% of its funds on medical research. The ALS Association, in the news today for the Ice Bucket Challenge, spends around 11% of total expenses across its national office and local chapters directly on medical research. In fact, most well-recognized charities spend less than a third of their income on medical research. And that includes charities that use evocative words like cure in their branding. Now, I don't mean to say that these charities spend the rest of their money on administration, because they do fund other important programs outside of research. But when we make a donation, we don't get to choose how our money is spent. Another thing stopping charitable giving today from helping a company such as mine with our heart failure program is the fact that many charities won't partner with companies. They typically fund academic research, which is important science and could lead to new treatments in 15, 20, or 30 years. But small biotech companies are struggling to fund new medicines that could reach patients in only 5, 8, or 10 years. And if you think that all new medicines are discovered in universities, I'd like to share with you the results of this government study. They looked at the 47 leading medicines to identify which of these have government or academic patent ties. They identified just 4 of them. 4 out of 47. And bear in mind, 2 of these, well, they're actually the same drug, just used to treat 2 different diseases. The truth is that academics typically work upstream of drug discovery. And most of the medicines that are prescribed to you, to me, by our doctors, they weren't just developed by companies. They were discovered by companies. And about half of all medicines currently in development were discovered by small companies. Small companies like my company. Small companies that don't currently make any money. Small companies that are completely dependent on investor sentiment to determine what drugs get tested. And I ask the question, do we want charities to partner with the companies that are expected to be responsible for half of all medicines in the 21st century? My answer is yes. And it's not because I work for one of these small companies. It's because I'm a patient. And in the end, it's our health, which means that it is our industry. And I say, let's get connected and let's make our money count. So how do we, the patient, get to choose how our charitable donations get spent? How do we encourage scientists to work on diseases that are ignored by traditional investors? And how do we create a place where patients and scientists can connect? Crowdfunding has shown us the power of the internet to make previously impossible connections. And I believe that we can make this happen for medicines. Earlier this year, I founded a new type of charity to make the patient part of the drug discovery process. Our scientific advisors will scour the biotech universe, looking for medicines that are struggling for funding. Our advisors will only be able to nominate medicines in which they have no financial interest. We'll collect donations online to allow these medicines to be tested for the first time in patients. Our focus will be those diseases that I've mentioned today that are ignored by traditional investors. When we make a donation to charity, we don't just want to feel good. We want to do good. And we want to know what good we're doing. Crowdfunding will allow us to build communities around new medicines, providing transparency not just to how the money is spent, but to the progress of the medicine through development. Imagine being able to fund a medicine in a disease that's personal. Watch that medicine get tested, see the results, and maybe even one day use that medicine. People ask me, am I worried that if we're successful, our biotech company partners will make money? I'm not worried. 100 years ago, someone made money from the discovery of adrenaline. When I was stung by that wasp in the Himalaya, my life was saved by the discovery of adrenaline. I think I know who got the better deal. But I do want patients to share in success. So we'll take a royalty on each new medicine that we fund, and we'll use this money to pay for medicines for the patients that need them, but who can't afford them. I want to create a place where we, the patients, can donate specifically to new medicines that have a chance of reaching the market in less than a decade. And this place doesn't currently exist, with the exception of a handful of diseases. I'd like to tell you about one of them now. Cystic fibrosis is a life-threatening disease. A thick mucus builds up in the body, especially the lungs. And patients with cystic fibrosis have a life expectancy typically into only their early 40s. 2 years ago, the first drug treating an underlying cause of cystic fibrosis was approved. Now, this drug, which is called Kalydeco, doesn't work for everyone, but it is an incredible milestone in the treatment of this disease. And Kalydeco is important to me because of how it was developed. The Cystic Fibrosis Foundation used the donations from patients, their friends, their families, to make a $75 million grant to a biotech company struggling to raise money to identify new treatments for cystic fibrosis. As a direct result of this grant, Kalydeco made its way into the medicine cabinet of patients like Emily Schaller. I asked Emily to tell me what Kalydeco means to her. And she told me that Kalydeco has given her a future that she never dreamed of. This year, she's setting up a retirement fund. This is something that never previously crossed her mind. Amazing things happen when patients, companies, and charities connect. Our organization is currently in its startup phase, collecting donations online to build our technology platform, and looking to launch in just over a year with 3 promising new medicines, each seeking funding of between $5 and $10 million. And if our new charity, which is called Impatient, can attract just 1/4 of 1% of the $31 billion that we already give to health-related charities, then together we can develop 1 new medicine every year, chosen by us, the patient, the connected patient. Because the next time I'm 5 minutes from, the next time you're 5 minutes from being seriously ill, let's not be 10 years away from our treatment. Thank you.